Hey everyone, Dr. Mike here. We've all experienced aches, pains, and the occasional out of commission day after pushing ourselves a little too hard. It's easy to brush off those feelings with a simple, it's just muscular, but is it always that straightforward? Today, we're diving deep into the world of pain, exploring why that statement can be misleading and why understanding the different types of pain is crucial for your well-being. The statement, "it's just muscular," is commonly used to downplay or simplify pain complaints, but in many cases it's inaccurate or incomplete. And look, I get it, life's busy and who has time for persistent aches? But ignoring the signals your body sends can lead to more significant problems down the road. While muscle strain or tightness is a frequent contributor to pain, especially in active individuals or those with poor posture, most pain felt in the body involves multiple structures, not just muscle. So let's break down the different types of pain you might experience and what they could mean for you. Let's start with what we're most familiar with, muscular pain. This type of pain is usually described as dull, aching, sore, or tight. You might even feel like your muscles are cramping up. Think about the feeling you get after a tough workout, that soreness you feel a day or two later. That's your muscles telling you they've been challenged. This is called delayed onset muscle soreness, or DOMS. Muscular pain is often localized to a specific muscle or muscle group. For example, if you strained your hamstring, you'd feel the pain right there in the back of your thigh, especially when you try to stretch it or press on it. This type of pain can also be caused by trigger points, which are like little knots in your muscles that can be incredibly painful. The good news is that muscular pain often responds well to things like stretching, massage, or applying heat. So next time you feel that familiar ache, try a little self-care before you brush it off as just muscular. Now, let's move on to joint pain. This type of pain can be a bit trickier because it can feel very different depending on the cause. Generally, joint pain is described as a deep ache, stiffness, or sometimes even a sharp pain when you move. You might feel it in or around the joint itself, like in your knees, hips, or spine. Unlike muscular pain, joint pain often comes with other signs like swelling, stiffness, and a reduced range of motion. You might notice that the joint feels warm to the touch or that it makes a clicking or popping sound when you move it. Joint pain can be caused by a variety of factors, including osteoarthritis, which is a degenerative condition that affects the cartilage in your joints, facet joint syndrome, where the small joints in your spine become irritated, or even sacroiliac dysfunction, which affects the joint that connects your lower spine to your pelvis. Nerve pain, which is also known as neuropathic or radicular pain, is a whole different ballgame. This type of pain is often described as sharp, shooting, burning, tingling, or even like an electric shock. It can also cause numbness or a pins and needles sensation. One of the key characteristics of nerve pain is that it tends to follow specific nerve pathways. For example, if you have sciatica, you might feel pain that radiates from your lower back, down your buttock, and all the way down your leg. Similarly, cervical radiculopathy can cause pain that starts in your neck and travels down your arm. Nerve pain is often caused by compression or irritation of a nerve, which can happen due to things like a herniated disc, spinal stenosis, which is narrowing of the spaces in your spine, or peripheral neuropathy, which is damage to the nerves in your extremities. Okay, now let's talk about ligaments and tendons. Ligaments are the tough, fibrous tissues that connect bones to each other, while tendons connect muscles to bones. Pain in these structures is usually sharp and occurs with specific movements, especially if they've been overused or injured. Think about a time you've sprained your ankle. That sharp pain you feel on the outside of your ankle is your ligament telling you it's been stretched or torn. Similarly, tendon pain, like tennis elbow or Achilles tendinitis, often causes pain and tenderness along the tendon, especially when you use the affected muscle. Ligament and tendon injuries are common in athletes and people who are very active, but they can happen to anyone. And because these structures are essential for movement, it's important to address pain promptly to prevent further damage. Now let's dive into a lesser-known but equally important type of pain, fascia-related pain. Fascia is a thin, strong tissue that surrounds and supports your muscles, organs, and other structures. It's like a giant web that holds your body together. When fascia becomes tight or restricted, it can cause pain and stiffness that can be difficult to pinpoint. You might feel a dull, burning or tight sensation that seems to move around or radiate to other areas. This type of pain is often worse in the morning or after periods of inactivity. Fascia-related pain is common in people with myofascial pain syndrome, a condition characterized by trigger points as well as those with postural distortions, like forward head posture or rounded shoulders. And finally, let's talk about referred pain. This type of pain is tricky because it's felt in a different location than its source. For example, you might have pain in your left arm during a heart attack or pain in your mid-back if you have a problem with your pancreas. Referred pain often feels deep and poorly localized, like a pressure or cramping sensation. It can be tough to describe and might even move around. While some referred pain is normal, like the example of the heart attack, other times it can be a sign of something more serious. If you experience referred pain that is severe, unrelenting, or accompanied by other symptoms like fever, nausea, or vomiting, it's essential to seek medical attention immediately. Don't ignore your pain, listen to your body. So, as you can see, pain is a complex issue. While muscular pain is a common and real experience, assuming pain is just muscular can lead to missed diagnoses and inadequate treatment. Remember, your body is constantly communicating with you, and pain is one of its primary ways of getting your attention. Understanding the type, location, and behavior of pain helps clinicians and patients identify the true source, whether it's structural, neurological, or systemic. By paying attention to your pain and working with a qualified healthcare professional, you can get the right diagnosis and treatment to help you get back to living your life to the fullest. And remember, if you're ever unsure about your pain, don't hesitate to reach out to a medical professional. They can help you figure out what's going on and get you on the road to recovery. Take care of yourselves, everyone.